Welcome to the third discussion on neck and headache pain. This one is an active discussion showing you some exercises, some activities that you can do to manage your symptoms and increase strength of your neck and postural muscles. On this one, first of all, I want to address standing posture and sitting posture, and then we're going to go into some exercises laying down first. With standing posture, standing and sitting and lying down postures. With standing posture, it's really important. I constantly hear people saying, oh man, I just don't know what to do. How do I know I'm standing correctly? Standing posture should be done in a relaxed position. You shouldn't be stiff, and don't focus on standing correct posture all day long, because you're going to get tired, you're going to get sore, and you're going to get frustrated, and you're going to stop correcting your posture. So kind of use a body awareness or a body cue. For example, every time you walk through a doorway, just stop and think about, what is my posture? What am I standing at? Or if you sit in a chair, the first time you sit in a chair, just correct your posture and then relax and think about it every once in a while, just using cues to become aware of it and correct it, but don't try and maintain that all day long. A couple of things that you want to think about is, as we elongate from the chest, that's going to correct all of our smaller muscle groups, like your neck position. When you're sitting or standing, your neck position shouldn't be forward like this. If I stand kind of slouched forward, if I just elongate, think of someone as pulling a string off the tip of my sternum or my chest, pulling me up into an upright position, my neck automatically drops into the normalized position. When I'm standing in this position, my shoulders and earlobes are roughly in line from this point to this point. My knees aren't locked straight, they're slightly bent. I'm in a very relaxed, comfortable with slightly bent knees and just in a relaxed position. Now, in this position, I should be able to swallow without nodding or poking my chin forward. Those of us who have head forward postures, when we get our neck too far into a more normalized posture, when we go to swallow, we tend to do this. We do a little bobble. If I'm doing a bobble or I'm having difficulty swallowing, I'm retracting or bringing my head too far back to where my muscles aren't used to that position. So I want to find that in-between position from that head forward to that way back, somewhere in between where I can still get in a more normalized position, swallow, and just maintain that position. After time, when the muscles under the throat and are in the throat and under the tongue, when they get strengthened in that position, over time they're going to get more normalized in that, and you'll be able to bring back into a more corrected position. But it takes time, and I mean it takes a long time, and this can be anywhere, depending on how fixed you are, from weeks to months to years of a gentle, gradual progression in that position. So that's the basic idea on how to think of your standing position. When you're sitting, if you're sitting in a chair, your knees should be at least level with your hips, if not slightly, and I just mean just a little bit below. I shouldn't be sitting forward slouched. I want to sit upright, and I really like to have people sitting in a chair that has some support. If they don't have support, a good chair, they can always take a roll up a small towel, put it behind their back, sitting against the chair and holding it in that position while they're sitting. And that way, if they're sitting back in a corrected posture, that towel's not going to roll down, and it also maintains that curve in the back. That's what we call that lumbar lordosis. When we're sitting for any length of time, we should be maintaining that posture. If I'm working at my desk, I should be tilting my head. And if I don't have glasses where I can focus down here and I can take them off, I tend to take the glasses off, because oftentimes we find that focal point in the lens is awkward or difficult to see. So then when I'm working on my desk, I'm just tilting my head, and I'm not holding forward in a stooped position for prolonged periods of time. Because like those talks previously talked about, when my head is forward, all the muscles in the back of the neck are contracting, and they're going to get tired and sore, and I'm going to wind up with increased neck pain and or headaches. Okay, so that's the basic sitting and standing posture, just a basic synopsis. The other thing with lying down, with sleeping posture, people have difficulty and they spend a lot of money on fancy pillows to give them that neck support. We do want a neck neutral support. We want to be able to keep this neck in alignment and the back when we're lying on our back or on our side. What I recommend is taking a towel, a little hand towel, rolling it up, putting it in the pillowcase at the bottom of the pillowcase, so it's the length of the case. So when I lay down on here, that support will support my neck, keep it more neutral while my head can drop a little bit, but keeping that neutral alignment. So when I'm laying on my side, this support is supporting my head. My knees are neutral. My back is in a neutral position, and I've got nice support, so I'm still neutral in this position, right? Now, if I roll onto my back, this is going the full length of the pillowcase, and I still have support for my neck. My head isn't way up, and it's not tilted back. It's in a nice neutral posture for me. So this is the cheapest and easiest way. If this works for you, you can always purchase one of those fancy curved pillows. Personally, I'm cheap. I use one of these, or I use a crimply, a little more firm but crimpled pillow. Typically, I'll use one of these that has a little bit of firm to it, but they're crumply and they crumple up, and I can crumple it in to get that same posture. So that's my sleeping posture. Don't forget, you want a pillow between your knees when you're laying down to keep that back in a neutral position. Okay, now what I want to do is look over a few exercises or review a few exercises. The first exercise we're going to talk about and show you is going to be one it's more of a core stabilizer for the neck. Everyone talks about core stability, they talk about tummy, they talk about some back muscles. The neck has the same components. You need to teach the neck to stabilize. Oftentimes we have these head forward positions, and these superficial muscles are overworked, elongated, and they're not meant to stabilize, but we fire them too much, and they're weak but tired and provocative for symptoms. So I want to teach the deep, what's called the deep neck flexors to fire, to work a little better. So in that, my preferred position is to have patients lying down or people lying down for this. However, if you're finding that's exacerbating or aggravating your symptoms, you can do this exercise sitting. I'm going to show it to you in laying down on your back first. So what you're going to do is, I have a little roll still under my pillow to support, because I want some pressure below my neck. I want to make sure that I know I'm pressing down there slightly. So my head's in a neutral position, my knees are bent just for support, just for comfort of my low back. What I'm going to do is think of fixating my eyes to the roof. At this point, the eyes and the skull are stable, they don't move separately. So what I want to do is drop my eyes, in other words, my skull position, by about 30 degrees. So I'm just going to tilt down like this. By doing so, I'm just going to add a little backward pressure at the base of the neck and just a gentle feeling. If this causes pain, you're probably being over aggressive. It should be comfortable, not painful. We're just going to do this little nod, almost making a double chin. So I'm going to tuck that in. That's relaxed. Okay, so what I do here is that little nod position is held for anywhere from 5 to 10 seconds initially. It all depends on how symptomatic you are, how chronic and how weak that muscle is. But as a rule, I tend to start people typically, if they're very weak there and have a marked head forward position, for a 5-second hold, and repeat that 5 times. So a total of 15 of those a day, building up to 25, eventually building up from 5 seconds to 10 seconds, and then eventually 30 seconds times 3 is pretty reasonable to expect. If that's uncomfortable or too difficult for you to manage, you can do this in sitting, but in sitting I'm not fighting against gravity, I'm actually using gravity to help me. So it would be the same kind of exercise. I'm sitting here, I'm in a good posture, my head's trying to be neutral, and I'm just going to tuck down and hold that. Both positions, it's really important to remember to keep your mouth closed, breathe through your nose, and keep the tongue against the tip of the groove. The first 2 teeth, there's that little groove in the gums. Just tip of the tongue gently resting on that point with your mouth closed. That'll allow you to open up and work the muscles a little more properly. Okay, so that's the first exercise, and that's the basic exercise everyone should be starting with when you're working on retraining posture and strengthening neck. The exercise there where I said that I start roughly at about 5 seconds, I'm going to show you some isometric exercises. In other words, gentle contraction of the muscles of the neck without moving the head or neck. And again, typically starting at about 5-second holds and 3 repetitions of each, building those up, progressing as tolerated. So thinking about these isometric movements is you're going to strengthen the neck muscles in all directions or all planes of movement, but you're going to do it in that neutral chin tucked position. So we're going to go into that position, and then gently I can hold my against one or two fingers, just add a light pressure backwards like I want to tilt my head up, but I'm just not allowing it. So I'm going to hold that for about 5 seconds. Again, and 3 repetitions. Then we can do the reverse. We can tilt our head into that normalized deep neck flexor position and then push gently forward so we're not allowing any movement there. I can also go side to side. I can also include rotations with gentle tucked position and a gentle tucked position with a rotation the other direction. On top of isometrics, I often start people doing an exercise where they're actually rotating, getting the little tiny muscles of the neck, the little rotators firing with a binder. So what we can do is take a binder, usually use a 3-inch binder for this exercise, get rid of the pillows, throw the binder down, and you're just going to rotate against the binder. Okay, so for this one, you're just going to lay on your side, take a binder, your head's going to lay on the binder, and you're just going to rotate to a neutral posture and then come back down. And it's an active movement, but we're just getting some neutral or some gentle rotation of the neck muscles firing. This one, it's not isometric, so you can start anywhere from, depending again on the acuity or the chronicity. It's usually safe anywhere from 3 to 10 repetitions. Remember the idea of pacing your activities though. Go gentle, especially the first time, because these muscles aren't used to being fired on most people. So as you start, it may feel good, but the next day or two may be increased symptoms. So you're better off starting at 3 or 4 repetitions and then progressing from there.